Hey, it's Bill from Friends with Medical Benefits here with Dr. John McGuire. And I'm going to mix things up a little bit with this podcast. Usually John and I consult, and I don't want to say we have a script, but we talk about what we're going to talk about and maybe come prepared with a little bit of notes. But a little bit differently today, John has no idea what today's topic is, and I'm going to throw it at him as a longtime physician who grew up in the same era as I did. Very curious what his take is as it might have evolved over the years. So I'm going to give you two words and say go. Well, I won't say go. That would be third word. You ready?
I
Medical
think
marijuana.
medical marijuana. Okay. Well, medical marijuana, I'm a fan. I'll just start right
Oh,
there.
okay.
Um, you know, boy, you're screwing with the Alzheimer's guy. A little bit of controversial topic, marijuana in general, but let's go back to when I first started. Marijuana was not being used medically. It was just a recreational drug. I mean, we grew up in the era where, quite frankly, in the high school bathrooms, people were smoking marijuana, particularly where my school was.
Well, I went to Catholic school and I rode a bus to a technical school, so I saw it a lot. I saw it a lot.
Yeah. So I mean that was my experience growing up with marijuana. But shortly after I began practicing, there started to be more research on marijuana, particularly in patients who had cancer. They started realizing that with some cancer patients, it helped their appetite, it helped with nausea and different side effects with chemo. There were people who had other medical conditions that over time it developed that there may be some appropriate use with. Uh, and then, you know, it, it was more research for my first probably 15 years of practice. So we'll say I practiced 35 years. The last 20 years, that research was becoming more prevalent, and there was definitely more indications that there was advantages to it. And there was probably a 5 year period after the research really showed the benefits where it was tough getting the government to authorize it. So you would go out and people would try to get it off any legal system that didn't exist at that time. But on the side, I know oncologists, and quite frankly, some of us would say, hey, look, you're having a lot of nausea, you can try it and see if it helps. It was a gray zone. It was really a gray zone for about that 5 years. So let's say 10 years of research, 5 years in the gray zone. And then some states started to look at it more for a legalization of marijuana. But the states had a difficult process. Like, how do you go from this is a completely legal drug being sold on the corners to now you've decided that there's a medical use for it? How do you make it available to patients? And that was a tough transition for the states that initially authorized it. And the process really started with, okay, well, we're going to allow certain major medical centers. So, for example, and I can't tell you which ones they were, but let's say in Pennsylvania, they said, okay, well, the University of Pennsylvania, we're going to start there. They're going to be able to have a way to dispense it legally to patients. And people regionally there could go to Penn or University of Pittsburgh or maybe Geisinger, and they could get it if those hospitals were willing to adopt it. And that's how it kind of started with the states. And it was still difficult for patients because the only place they could go get it were these small centers that dispensed it. And if you weren't living near it, it was a little bit of hassle. And as many of our patients, or I shouldn't say patients, as many of our listeners know, if you have someone with cancer, it's kind of tough if you're 2 hours away from the University of Pennsylvania and your loved one has colon cancer or lung cancer, and you have to go 2 hours to get their marijuana, and you didn't know how much you could get at a time. It was limited. So that was the transition phase. And then you had probably another 5 years where it became more regionally easier to get it. It wasn't that small hospitals had it, but then you developed spots where in many states, medium-sized hospitals were able to dispense it. And then finally, states started to adopt, okay, we're going to have medical dispensaries. Probably one of the first ones to take it on, and I don't know the specifics on who was first, and this is where Bill threw me under the bus a little bit. Didn't have time to research this. But I would say like California probably was one of the first ones to come out with medical dispensaries where you got a script from, you could get a script from your primary doctor, your psychiatrist, or your oncologist, depending on what it was being used for, and you could go to a dispensary and you could get it with a script. And that became more common through many states. Now, typical of politics in the time we're living in, which unfortunately is a reality, there were certain more progressive states that adopted it much quicker than some of the more conservative states. And that's just a reality of what we live in. But probably, I would say, over the last decade, maybe a little bit longer than that, medical marijuana was pretty much, you could get it in any state. Then, you get into the last 5 or 6 years, pretty much everywhere, the medical marijuana was easy to access. And now we're in the time of where it's gone beyond medical marijuana to more recreational marijuana. And I don't want to get too much into that, but that's made it even more accessible. And, there's a lot of stuff on the internet that's good, a lot of stuff that's bad, and that's a tough decision. But what I did see a little bit more of in probably the last 10 years, 8 to 10 years of practicing was self-medication. So rather than go to a psychiatrist or, get a script for medical marijuana, someone had anxiety and they heard from their friend, hey, look, I take it for anxiety, or, my appetite's down or something. And they'd go to a more recreational dispensary and get it and try it. So it's almost becoming a transition from a prescription medical marijuana to a more over-the-counter medical marijuana treatment. So an example of that would be, let's take your antacids, the omeprazole, which was a medication that we used to have to prescribe. Then it became over-the-counter. Well, more and more people started treating their acid reflux by going to Walgreens and getting some omeprazole and treating their reflux. So we started to see more and more people that were having anxiety or something like that. Not severe anxiety, but rather than going through, necessarily getting a script from a medical marijuana prescriber, they would just go and they would get it at a dispensary, or, it became more easy to get it on the street and less, quote unquote, illegal. So we started seeing that. So that's a transition that I see happening now, where there's a little more, hey, look, I'm just going to go try this, see how it happens. I heard people say, I got a little bit of anxiety. Someone told me medical marijuana helped. I smoke marijuana occasionally, and it seems to help. And great. There has been a use for it. And I have, from almost day one, I have been a proponent of medical marijuana, particularly from day one with cancer patients. I have always, go ahead, Bill.
No, I was just going to say that surprises me a little bit. I'm not surprising of your opinion now, but surprising that you've held it for so long. And what I think a lot of younger people don't understand is the stigma attached and the taboo of marijuana. I mean, there were Cheech and Chong movies, and as you said, kids smoking in the bathroom, but so-called civilized society, it was demonized beyond like logic. It was the gateway to heroin and cocaine, and honor students don't smoke pot. And it just, I look now, even shows like 10 years old that are crime shows and somebody gets arrested and they have an amount of marijuana on them, and the punishments and the severity of the crime just didn't fit the substance, which I don't want to debate recreational marijuana, but if you were going to logically, with no bias, compare marijuana, alcohol, and tobacco, which is the least dangerous of those three?
Yeah, I mean that's the debate, and like we said, we're not going to get into recreational
Right.
marijuana, but I will say now, all that being said, I honestly have never smoked marijuana once
Right.
in my life.
Yeah.
I've had no desire and I've had no need to. But what I will say is I've been a patient advocate my entire life. And the one thing is very early on, and I'm going to stick with the cancer patients because that's one of our big subjects. There was a lot of good data that cancer patients who had nausea after chemo, it helped. And I am of the opinion, someone who has cancer who may be dying from it or is trying to survive it, I don't care what they do. They have every right to try everything that'll help them. And I was 100% when that data started to come out. If they wanted to try it, I said, go for it. Because once you got cancer, what's the downside?
Right. Right.
I'm a realist. And that's, to me, number one was my patient's comfort and satisfaction. Like I said, I'm going to go back to my policy is I always cared what was best for my patients, and that's why I was a proponent of it early on.
Yeah, well, I'll share my opinions on it a little bit. Then I'll talk about personal experience. But just the fact that, and again, this all stems from the taboo that marijuana was once considered to be. The amount of outrage about how harmful it was in comparison to other illegal drugs or legal drugs was just ridiculous. And I fell into that trap and believed all of that. But if you think about now all of the medications that you were able to prescribe, you could probably rattle off how many medications could you rattle off that you were authorized to prescribe that were, never mind the benefits to the patient, but if misused, how many medications could you prescribe that could be more hazardous or more harmful than marijuana?
Oh, absolutely.
Yeah. Yeah. Now, I believe that it's gone the other way, and some of the claims, yes, it helps cancer patients, and especially undergoing chemo with nausea and everything. But then you hear the other side of it now, if it cures cancer and all of these other, yes, it wasn't nearly as harmful as we were led to believe for many years. And I do believe that there are benefits, but I believe now that the hyperbole is going in the other direction as well now. So we're going to pause here and break this into a two-part episode. In the second part, we'll have John's response to what I just said, and then I'll be giving a lot of information on my experiences as a cancer patient and a cancer survivor with medical marijuana. So thanks for joining us, and we'll see you in 2 weeks.